So good evening, everyone. Today, our focus is, as you can see, with preeminent leaders and senior executives from the Indian pharmaceutical industry.
There is a
So,
stated talent shortage in the pharma industry, and there's a latent talent shortage in the pharma industry, as we say today. And indeed, there is a shortage of talent. Okay, and it's happening on two counts. One is, you see, if you look at the growth of the pharmaceutical industry in India, it's been huge. It's been humongous. Uh, if you see the growth of healthcare sector itself, where pharma is a large part of it, has been huge. Okay. Uh, there are so many pharma companies which are in the $100 million club and $1 billion club, which weren't even there 10, 15 years ago. Okay. So that's the
so
good news. That's the good news. And that's the India story, which is unfolding. But what is happening is, uh, instead of fresh and new talent coming in, a lot of talent is rotating, within those companies. Now, Amitava will also tell you, we are also in that space. They are in that space, especially biopharma. Okay. Now, these are skills which cannot be built overnight. Okay. And these are skills which take a long time to build. But when you are making vaccines or when you are the biopharma or biosimilars, whatever, whichever way you want to call it, the companies need those skills. Okay. And they are not just in manufacturing or in sales, it's mostly in technical fields such as manufacturing, regulatory, medical information, medical affairs, of all these, which are so. What happens is that the same talent is rotating, and then everyone at some point of time feels that talent shortage. Um, the second thing which is really impacting, in my opinion, and then I'll hand it over to others, is so what is happening is, if you look at it, and that's where the industries are merging, Andre, even in my notes that I had sent you earlier, the industrial
so
skills cross industry are merging because of digitization. Okay. So if you have done regulatory affairs of a gaming company today, those skills are absolutely relevant to uh, a pharma company which is going in the digital services. Because what you need is knowledge of digitization and the regulatory frameworks, how they work. Okay. So these are the latent talent shortages, if I may call and say so, where many a times companies don't even know how to properly define the JD, and you want to hire for that. Okay. So that, in my opinion, is what is my 2 cents worth. Now I request Amitabh and Mr. Jain to talk about it also.
Okay, so I'll just build on what Yash was saying. It's very correct and very true that the skill shortage is quite acute and it's becoming worse. But the way I look at it, it's not just for pharma. It's for several industries because India as a country is going through a very high growth curve. And when that happens, the talent pool doesn't keep up with it because it takes time for the talent pool to get experience because a lot of learning is on the job. You can't teach them, like Yash said, in schools or colleges or overnight over any other platform. Now, if you look at pharma is a very knowledge intensive industry. And here, your education is just the platform to launch you. After that, everything comes from experience. And as Yash was saying, the more we are diversifying our products and portfolios, each company, we are trying to get people who have relevant experience. In many such cases, the experience probably is outside of India. And it is not easy to get that talent pool in at short notice or at a constant basis. So it's always a tug of war between your growth as a company, training your internal pool, losing some of your best guys to someone else in the industry, and then trying to attract people to fill up that void. So whether you talk of regulatory, whether you talk of quality, whether you talk of manufacturing, everywhere the talent shortage is at a certain niche profile or at senior leadership level, right? And it is being felt, in my opinion, across the industry. So I'll take a pause here. Mr. Jain, please.
So first is thank you very much to PSS, Andre and Mario is here for inviting me for this discussion. I have been a business head for the years, and I now work in private equity policy shaping. So I will first start with a comment that this is going to be the decade of healthcare for India. And maybe over a period of time, I will say why it is the decade of healthcare. Two sectors which will make difference to this country. One is IT, but IT has moved hell of a lot in talent game. And second is pharma. So that is one of the important things. And the name of the game for the companies which are going to make difference is talent, 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 because talent is going to be the differentiating edge. And what I think is, I keep on talking in all the forums with the CEOs, that the key role will be HR. What IT did for 2000K, HR will do for 2020 and going forwards. So the companies which will win the game is HR-focused companies which realize the value of talent. And Yash has been part of those companies. J&J, I worked, Lupin, I worked in the earlier days. I've been part of Abbott over the years, where talent and talent and talent is the critical factor. And it is not only HR agenda, it is the top management agenda, right? So that is point number one. Point number two is war for talent. So war, when I say, how do you win the talent? How do you assimilate the talent? And how do you make the talent result-oriented? Given the fact that you have to win the war of talent. So war for talent for me is getting the best talent, winning the best talent, assimilating that talent in the organization, because you can get the talent, but most of the times you can't assimilate that talent and make that talent result-oriented. It is not talking. It is walking the talk, which will make the difference. Point number two. Point number three is, given the fact that India will play a vital role in healthcare, the days of talent, even what marketing was yesterday. I used to do marketing, say, 3 years back and recognized for building the brands. But the marketing requirement today has undergone a fundamental change. Because what we are looking for is the access of medicine in this country is only 30 to 40%. Communicable diseases are going up. So the skill of just working with Salesforce is not what is required. You need omni-channel approach. I'm just giving one example. So the kind of talent which you need is undergoing a fundamental change. So first is talent will win the game. Point number one. Point number two, healthcare is a winning area. Point number three is, what is the talent gap? Maybe we can discuss in different areas, the way it was there, what will be required for the future in the current areas, and what are the new talent requirements which will be there going forward.